Imagine this. You've spent years studying, sacrificing sleep, and pouring your heart into nursing school. Now, just one test stands between you and your dream career. But here's the big question. What separates those who pass from those who struggle? Hi, future Nancy's. Welcome to this channel where we can cover the key strategies to conquer the NCLEX with confidence. I've been in your shoes, but trust me, guys, passing is absolutely possible. The stocks are in your favor. Let's get started. So, right in front of me is my #1 content book, Sounders Comprehensive Review for the NCLEX-RN. So anyway, without further ado, let's get started. So guys, tips to fix the NCLEX. Yes, you need strategies. It's not just about having your knowledge, nursing school knowledge. No, you need strategies and tips. This is gonna be a short video. We'll be back to our channel, Clever PC, which is all about passing IELTS, NCLEX, immigration guidance, everything we're connected with immigration. So what's the NCLEX? National Council Licensure Examination for registered nurses. That's NCLEX-RN. There's also NCLEX-PN, which is for practical nurses, but this one is for registered nurses. So if you have a diploma or you have a bachelor's degree, you are termed as a registered nurse. So what's the reason as to why people sit for this exam? First off, it's only nurses who are licensed to actually sit for this test. You actually tested through document verification, through applying via the State Board of Nursing. So you can't just book this test, all right? So the test is to officially give you that license to practice in the United States, any state, depending on your state where you applied. So the distance in Africa, we have Nairobi, Kenya, which is the latest, which is the baby center. However, earlier on we had Johannesburg. I sat for my test in Johannesburg, South Africa. The rest used to be Mumbai, India, which was common. Most Africans used to go to India. We also have London, Philippines, and Philippines, there's Manila in Philippines. So anyway, you can sit your test. Yeah, if they have a free, test seat, you can always schedule it, book it, and go and sit for it. So now let's dive into the tips. Yes, tip #1, guys, before you even think about any tips, core content is key. Core content. What does core content mean? You have to know everything from A to Z, not just knowing everything, but what's it. For instance, if we go to pharmacology, you know the class of the drug, the mechanism of action, the side effects, the adverse effects. So if we move on, you really need to understand the system processes, the pharmacology, the topics, all the system, cardiovascular system, integumentary, maternity, pediatrics, So what are the resources? You see all the resources, A, B, C, D, and E? These are like 5 resources. And for you to really master this core content, I recommend to use all these 5 resources in order. Don't start with E. No, you gotta start with A. A is Sounders, I think. Showed you Sounders right here. And if you're interested in my book, please check the first link in the description below. It directly gives you the link to download this document. It's a 3,000 page book. That means you actually need to take your time when you're grasping this core content. It can take you like 3 to 6 months mastering this content. So every system, what you're gonna do, every system has to be divided. It's best you did a book like this, and then if it's cardiovascular, let's just have only this book. If it's maternity, let's just only have this book. However, you will notice that a pediatrics book will be much bigger than an a cancer disorders book. So they might vary. You might just use only a few pages for cancer, but however, for maternity, you might actually fill the whole book. So start by being organized in your head. The way you grasp your core content is that if you decided that these 2 weeks you're gonna concentrate on cardiovascular, please just concentrate on cardiovascular. If you try to figure out, what most of these mean, for instance, we can have like heart failure, and heart failure is giving you hard time. Now you turn to B's registered nurse.rn.com. This is a lady called Sarah. So she has, all the systems, and she explains, her videos very well. She's a grandma in the game. If you don't understand this, you could discuss this system with your colleagues, or look out for other YouTube channels that are gonna explain this very well. So try to understand, because understanding is what's going to literally get you to understand that core content. So so we have simple nursing. Simple nursing just gives you the mnemonics, the NCLEX tips, what NCLEX really wants, because the moment you get or master the psychology of the NCLEX, then things are gonna be right for you. You'll know what to read. You'll know what not to read. And sound has highlights this, because for every system you finish, there are always these questions in the middle. So I told you, like I said, the link to downloading Sounders for free, it's just under the description. Please check the description. So I also wrote here Kaplan. So you could just choose Sounders or Kaplan. However, don't read both, because they are all the same. However, if you decide to go with Sounders, please go with Sounders. If you decide to go with Kaplan, please go with Kaplan. I personally prefer Sounders. Okay, so then we have Nexus. Now these two come later, because they are mostly MCQs, just questions. Nexus Nursing Institute, that lady, Professor D, just explained, it's just a matter of MCQs. So make sure that you are done with all the systems, and then you come to D and E. So core content is what is paramount. Tip number 2, if it's an MCQ portion, please look for opposites. If one of them is saying stop the infusion, and then the other one is saying increase the infusion, so that means there must be, of these two, there must be the correct answer. So you have to really critically think which of these two is the correct answer. So that's what I'm trying to talk about. Then tip number 2, NCLEX is a computer adaptive test. What does computer mean? That means it's the computer assessing you, not human beings. This is free of human beings. So what will happen is that it's adaptive. What are you saying? So when you pass or fail, it's the computer that has marked you. So how do computers think? The moment it gives you the first because the first 5 questions or 10, they're mostly knowledgeable questions. That's why I told you that core content is key. Master your knowledge. So if it gives you these questions and then you pass them, let me say you pass the first 10. Oh, then it's like, oh, this guy is sharp. So it will give you harder questions. Again, you pass them. So think about it. Remember, the moment it gives you questions and then you keep passing it. Let me say, if this is the graph, and then the graph just keeps on increasing. So this book is to where my pass mark is. So that means you are veering off of the pass mark. So that means towards question 35, you failed it. It will only just slightly low a bit. Then when you pass the other one, it keeps on increasing. So the graph just keeps on increasing, especially when you began steering away from the pass mark. However, if you begin by fading failing, that means you're playing around with the what? With the pass mark. And it might just cross over 85 and then continuously gives you questions. So always beat those first 10, ladies and gentlemen. So, and then when we move on to set us up, this is select all that apply. That means MCQs, but they want you to either choose more than 2. So right here, we have case studies. Please make sure whatever option you choose is 100% correct. Because now this is a computer, it thinks of perfection, like it's perfect. It's perfect. So the moment you start trying to giving those wrong answers, it will be like, wait a minute. He's not sure he might receipt this test. Or I might continue giving him questions. So you have to make sure that when these set questions come or case studies come, you make sure that you're giving answers which are 100% correct. You choose those ones which you are 100% sure of. Alright, tip number 3. So when with self all that applies, kindly treat each option as either true or false. Like try to handle each option separately. Don't try to mix it. It's only self all that apply, alright? Alright, tip number 4. Stay away from absolute. This is very important. In most cases, they are wrong. For instance, answers with options that involve always, never. Free away from such questions. Always, never. That means the absolute. Instead, consider questions that say often, frequently, sometimes, usually, potential, almost potential. So you will always get this as you continuously practice. So then tip number 5, pay attention to questions that say, what should the nurse do first? So you should always think about priority. Those are the ABCs: airway, breathing, saturation. So with airway, that means you have to keep the airway patent. Anything that's blocking, maybe so much secretions, that's a priority. The nurse should actually intervene by suctioning. Then breathing, that's giving oxygen. Oxygen is priority. In saturation is blood. Things to do with hypertension, low blood volume, bleeding. And then Maslow's hierarchy of needs. That means that we have psychological needs and then physiological needs. Which one is the priority? Psychological and physiological. Physiological, because that means nutrition, water, temperature, vital signs. Those ones, they're a priority. The nurse has to really give some attention to those. Alright. Questions that need clarification. Question, what should the nurse question? What should the nurse clarify with the HCP? Which one needs further teaching to the client? That means they're looking out for their wrong answer. Clarification, questioning, further teaching. They're asking for the wrong answer. So you have to look out for the answer that's wrong. And then thirdly, assessment takes precedence. So if something is not an emergency, if the client comes in and it's not an emergency, the client has already been stabilized at the ER. So make sure you first assess whatever patient you get, kindly assess. That's nursing care plan, ADPI, assessment, diagnosis, planning, intervention, and evaluation. Alright, tip number 6. Alright. Rarely should you pass on the book to the healthcare provider, the doctor. You have to do some intervention before you actually turn your head and then call doctor. No, you could just, for instance, if the patient is not breathing alright, you could just raise the head of their bed. Such interventions could bring up those SpO2s. And then rarely should you choose to continue to monitor. Please, the NCLEX, every caution, they put hundreds and hundreds of dollars, so they can't just tell you to continue to monitor. So in most cases, side effects then you'll continue to monitor. But when it comes to adverse effects, in most cases you stop the infusion. And like I said, adverse effects common in the NCLEX. Then tip number 7, avoid asking that patient why. Don't worry, avoid that. Those are non-therapeutic. So any option that you're saying, why did you this? Why did this happen to you? Please stay away. Statements that are judgmental, statements that say don't worry, why, stay away from those. Alright, tip number 8, pay attention to time frame. Any question that's talking about time frame, any question that's talking about time frame, stay away from those questions. For instance, if the patient is coming out from surgery and they say, has just come out from surgery just a few minutes ago, what should you monitor? And then they say monitor for infection, and then the other option is like monitor for bleeding. So the infection and then bleeding. If the temperature is to go up, it will go up later on. But then bleeding, the patient might be bleeding. Alright, that means they will ask you to monitor the blood pressure. Alright. So you could just look out for any signs of bleeding from the incision site. So that's immediate. Alright. Alright, now tip number 9. Alright, summarize and make mnemonics for most conditions. And simplenursing.com, the YouTube channel, provides this very well. For instance, in endocrine, they say hypothyroidism and then hypothyroidism. As you hear, hypothyroidism, everything's up. The temperature is up. The blood pressure is up. Most of the vital signs are up. And so the heart rate, everything, temperature, the breathing rate. In most cases, hypothyroidism, the patient is what is up. But then when it comes to thyroidism, everything is down. Blood pressure is down. Heart rate down. Alright. So, and then about another mnemonics, I think I can think about tuberculosis. So tuberculosis, I think it's more of like 3 weeks, and then so with 3 and then you're free. So there's something about tuberculosis, but anyways, there are quite a number of mnemonics simple nursing really helped me with, especially with I think with drugs that are connected with treating tuberculosis. For example, we have that synonym RIPE. We have rifampin, isoniazid, pyrazinamide, and then ethynambutal. Ethynamide, something like that. So with ethynamide, with rifampin, so that means it comes with red eyes as a side effects. So those mnemonics, they are very, very important, ladies and gentlemen. So as well as actual review notes as well, they give some great mnemonics right there. They have some actual review notes with me, which I'll share as we go along with these videos. But anyways, yeah, that's it. Mnemonics, get them from simplenursing.com. Actual review, very great mnemonics. Even nurse-RN.com gives some good mnemonics. So remember, there's too much information to read. So great mnemonics, oh my god. Alright, tip number 10, I'm repeating the first tip. There is core content. You can't pass the NCLEX when you do not have what we call core content. First, build that foundation, alright, before you go ahead looking out for MCQs. Alright. With that said, thank you so much for watching, and make sure you subscribe to this channel, and thank you so much for watching. Please have a great rest of